In the first quarter of 2019, the hospital recorded client attendance of only 73. In the first 3 months of 2021, however, the UGMC has already served 4,000 clients. Although it's used to solely accept patients based on referrals, it now allows for walk-ins for persons who need specialist care.
We've had a lot of patients who are being treated somewhere for diabetes or hypertension, and they feel that, well, if I have a cardiologist here, why not? So you don't necessarily have to be referred. You can come in as a walk-in patient if you are you have a secondary condition or a tertiary condition, because what we didn't like is maybe simple malaria and other things, unless you have visited your primary service and then the malaria is a complicated one, then maybe you'll be referred here. But we will encourage that if you have any secondary condition like a diabetic or hepatitis or anything, that we have all these subspecialists here. And so nothing stops you from deciding that, look, I want to see the cardiologist, I want to see the diabetologist, I want to see the gastroenterologist on walking. So we have a combination of referral cases as well as walking.
For Teddy Tonime, one of the about 20 neurosurgeons in Ghana, he is worried about how young people are falling to stroke. He says they are also becoming more and more hypertensive, a condition which has accounted for most OPD morbidities in the first quarter of this year.
At the moment, it seems like we have an epidemic of brain bleeds, so especially amongst young people. So we're getting younger and younger people who are undiagnosed hypertensives, and the first time you see them is when they have a stroke. So usually they've bled into the brain, and this is where they present. And because we don't have a very good screening system for hypertension, a lot of our young people are walking around undiagnosed, and that predisposes to people not starting their treatment early enough. And sometimes the first time we see them is when they present with a stroke. So if we do not have a way of diagnosing hypertension early and picking them up, we lose more young people. And the ages of the people can be as low as 30 years.
So what can we do to prevent such things from happening?
Well, first of all, we must have a national screening program for hypertension amongst young people, right? We must also have our insurance covering antihypertensives completely, across a large spectrum. And we must make it important that hypertension is followed up when a patient goes to the hospital. And we have a way of following people who are diagnosed to make sure they're being treated. Yes. And then lastly, don't ignore a headache. Don't ignore a headache. Don't ignore a headache. Talk to a medical person if you have a headache for longer than 3 weeks, right? And get examined. Ultimately, we young people, we should realize that diabetes and hypertension are lifestyle diseases, and the more sedentary we are, the more we empower their bad effects. So let's be a bit more active, but ultimately don't ignore headaches.
As the country's first ever quaternary hospital, it has the capacity to offer advanced medical treatment. However, UGMC has additional responsibility of championing research and training. When the idea of building a hospital on the University of Ghana campus was mooted, it was supposed to offer practical training to medical students as well. That is why the facility now has a training and simulation center for pre-service health professional students to experiment in a realistic but risk-free environment before encountering real patients.
Yeah, this is a nursing and simulator, primarily for use by nurses and practicing nurses as well as student nurses. But because it's a high-fidelity mannequin, you can use it for training doctors, even practicing doctors, for continuing as part of their continuing development program. once you set it using the SIM pad, you can control whatever you want to do. For example, if you want to listen to the heart sounds, you set it and then you listen. Oral care, denture care, care of the eyes as well as ears, tracheostomy care. So there are so many things that you can take the blood pressure, you can feel the pulse, intramuscular injections, you can put in an accessory, so that it will simulate pregnancy, wound care, and a whole lot.
We want our services to be different, the way we communicate to our patients to be different. So that's the training that we are doing for now. And aside that, we also do monthly research forum to allow researchers to showcase what they've done, and also to educate and then encourage those who are out there to do research. We want people to know that to be able to get good health outcomes, research is an area to go. Because if we have COVID patient coming to UGMC, if after seeing them, all of them present with different symptoms, we don't research into what happened, and later we are hit with another or similar something like COVID, we wouldn't be able to know how to handle it well. But if we research into the symptoms and know whatever happened, and know the kind of medication that we gave, which improve others and all that, it will help us to treat people better. Research always helps to improve service delivery and also health outcomes of patients. So research is very important for everyday life. So we are here to do research.
The fortunes of the University of Ghana Medical Center is changing as it now sees many more people than in the past. It says that in a month or two, it would complete the second phase of the facility and open up fully. Reporting for Citi News, I am Ni Ama.